Hello everyone, we welcome all of you to our webinar. My name is Rebecca On and I'll be assisting as the moderator. Today's webinar will be on dental photography, how to bring your work to light. During this webinar, the presenters will provide you all the information and demonstrations to get you started in taking those high quality dental photos. Furthermore, you may receive 2 CE credits after today's participation. You must stay active during the whole session, and at the end of the webinar, a pop-up window of a survey will appear on your screen. If you do not see a pop-up, you will also be receiving an email from GDIA Live with the survey link an hour after the webinar has ended. Once you have filled out the survey, you can expect to receive your CE certificate by email within 14 business days. As shown on the screen, there will be a question box in the panel board. Please feel free to ask questions in the question box throughout the lecture as the presenter will address them during the live Q&A session after the lecture. Without further ado, it is my honor to introduce our speakers for today's webinar. Dr. Jang is a graduate of the dental school at University of Pennsylvania and received his Master of Medical Sciences at Harvard School in Massachusetts. He completed his prosthodontic specialty training at Harvard School and is also a board-certified prosthodontist. Furthermore, Dr. Taesung Koo is the owner of W Plus Dental of Washington, D.C. He received his undergraduate degree from the University of Notre Dame and received his Doctor of Dental Medicine degree at Tufts University in Boston, Massachusetts. He currently serves as a clinical faculty member for the GDIA Live Patient Surgical Training Programs. With that, I ask that you join me in giving Dr. Jang and Dr. Taesung Koo a warm welcome to the screen.
Thank you, Rebecca. Hello, everyone. My name is John Koo, and I'm joined here today by Dr. Jang here.
Hello, everyone.
All right, so let me start off. Let me give you a short presentation just to kick us off, and I will let Dr. Jang, he is the master in this topic, so he'll be giving you the main lecture here tonight. So what do we know about photography? Pictures tell a million words, and I'm sure as a dentist, we probably started somewhere along the lines of taking pictures of iPhone or Android, our cell phone photos of our anterior work, just because we loved what we saw, our work, and we just wanted to show it off. But this just doesn't show much. And I'm sure many of us went and got a DSLR with a macro lens and some type of flash with ring flash or twin flash, and we start to take some more detailed photography. And then you realize you go on Instagram and you see people like this. This is Dr. Jang's Instagram page. And you look at photographs like this, it's just, wow, how do you take these kind of photos, right? I mean, at least that's how I felt. And your end goal, or close to this, will be your end goal for your photography. So this is actually same patient, same person with an iPhone photo and a ring flash photo, and then the last picture on the bottom is taken with twin light with diffuser around it. So it's all about exposure. So for the part of the lecture, I really want everyone to focus on pay attention to this part, exposure. This is the key element to photography. If you do not understand this part, if you go ahead and buy the same equipment as Dr. Jang has, you're not going to get the same results. You have to understand this. There's no single formula that works for everything. So please pay attention very closely on this part. A lot of people will just skip over this, but please take my word for it. And Dr. Jang will go through all these as well. And I'll come back to discuss a little bit more afterwards as well. So, so please give your warm welcome to Dr. Jang.
Okay, so hello everyone. Good evening. I'm so excited to offer this dental photography course on a webinar format with GDIA. Dr. Ku and I have been preparing this for a while now and spent many hours trying to give you the most realistic demo of how we take our photos. And I want this webinar to be more of a comprehensive lecture on dental photography, not just giving you the equipments that you should buy and the settings that I'm using. Um, what's more important about taking good dental photos is 90% in person who's taking photo and 10% on the equipment. So of course I'll give you all the recommendations for decent equipments that you can buy, but you should focus on more of a general comprehensive science behind taking dental photos. Okay. So by the end of the course, you'll know how to adjust all your camera settings and how to frame and edit your photos and how to light your subject in a studio quality lighting. And I'll also give you some equipment recommendations and settings that I'm using and give you some guidance in making a right purchase decisions for if you're looking to buy a new camera at this point. With that said, let's get started with the basics of photography. There are four components that I want to cover in this section. And first of them is the composition. Okay. So what composition in general term is, it's the way in which something is put together or arranged. In photography, it's how you frame your image and how you crop your image. And there are certain rules of composition that you can use. There are a bunch of them, but you mainly need to know just one. It's called the rule of third. So what it is you divide this photo, this image into three equal lengths, both horizontally and vertically. You'll get these lines. You'll get four lines and four cross points. Now, if you put your subject in one of these four cross points, you're using rule of third. So in this photo, I try to put the subject who's about to cross the street on the lower right cross point. And this kind of gives the image more stable look. I also purposely use the lower horizontal line to demarcate the difference between the road and the vertical buildings. And that also kind of gives the image more stable look. Lastly, I use this road to kind of lead the viewers to view to the lower right cross point. So that makes the image stable. This is another photo, same rule. I use the road to guide the viewers to the upper right side corner. And then this two subject, I kind of place them on the lower left cross point. You don't have to be exact in putting this into those four corners, but it just serves as a general guideline that you can use to place your subjects. Another photo, I put these two ducks on the lower left corner, and that building is on the upper right cross point. This is a building that was featured in The Sound of Music in Austria. And you can use this in dental photos as well. So in this photo, I purposely placed that burr right on the lower left cross point, like so. And on this photo, I used to align these restorations in the lower horizontal line. If this image were to be placed something like this, viewers will get confused because you have too much background on the lower half of the image. So if you look at this in the rule of third, it's right in the middle. If you bring this down a little bit and kind of use this lower horizontal line to align to arrange your images, the images look much better and more pleasing to view for the viewers. Now, whenever you crop your image or frame your image, you want to give focus on what you want the viewers to look at. So let's take a look at this image. This is a lateral shot of the posterior teeth. And if I didn't say posterior teeth, you're looking at the anterior teeth as well. So if you want your viewers to look at the posterior teeth specifically, I would crop this photo like this. Now there's no discussion about like where should I be looking at, what should I be looking at. You're looking at the lateral aspect of the posterior teeth. Okay, same goes for the frontal shot here. This is already good, but if you crop it down just a little bit and kind of give more focus to the teeth, then it looks a little better. So that was it about the composition. It's an easy topic to get started with, but mainly this is the good stuff. It's exposure. Okay, so exposure in simple terms is how bright the image is. So if you look at these three images, the middle one has a correct exposure. If you hear people saying the image is underexposed, that means the image is too dark. If you hear there it's overexposed, image is too bright. There are three camera settings that you can use to control your exposure, and those are ISO, shutter speed, and aperture. So every DSLR or every professional grade camera, other than the iPhone, these days iPhone even have these options as well. But most cameras, you can manipulate these settings to make your image either brighter or darker, and we'll go in detail for each of them. Okay, so on my camera, it's listed on the top. You see 100, that's a shutter speed. F29, that's referring to the aperture setting. 200 on the bottom refers to the ISO setting. 100 means, the shutter speed 100 means it's 1/100 seconds. That's the duration that the sensor receives the light. It's not 100 seconds, but let's go over in detail, starting with the ISO. ISO is the film's sensitivity to the light. So in low ISO setting, you have the sensor has low sensitivity to the light. In high ISO setting, the sensor is more sensitive to the light. So if you want your image to look brighter, you will increase the ISO setting to a higher setting. If your image is too bright, you will reduce your ISO setting, and that will make the image a little bit darker. Now, this is the set of photos that was taken with all the same settings except for the ISO. So as you increase the ISO, the image gets brighter, but there's something else that's happening when you increase the ISO. So let's zoom into those red boxes that you see, and this is what we see. As you increase the ISO to a higher number, let's say 6400 or 12,800, you can notice that the image is becoming more grainier. Okay, it's more noisy and there's some fuzziness to it. That's in professional terms, it's called the noise of the image, and that's something that happens if you increase the ISO too much. So there is, and you don't want this noise on your image for our purposes in documenting teeth. So in general guideline, I rarely go above 1600 in ISO when I take the dental photos. Rarely, if I have to, I'll go to ISO 3200. Okay, so that's it about the ISO. Let's talk a little bit about the shutter speed. Okay, so the shutter speed is the duration of the time when the film is exposed to the light. So fast shutter speed means the sensor is exposed to the light for a very short period of time. Slow shutter speed means that the sensor is exposed to the light for a very long period of time. And as you can imagine, if the sensor is exposed for a longer time, the image is going to get brighter. Okay, so this is another set of image that all the other settings remains the same. The only difference is the shutter speed. And you can notice that as we make the shutter speed go faster, you're going to notice that image is getting darker. Now, just like the ISO, something else happens if you decrease the shutter speed too much to make your image brighter, and that is the motion blur. So when the subject is moving, for this example, this dolphin has two fins and that's rotating really fast. And you can notice that on the fast shutter speed, 1/1000, you can see that the fins are not moving. But as you decrease your shutter speed, you can see that that fins gets blurry because that is a moving subject. And this applies to dental photography as well, because even if you ask your patient to stay still, they move a little bit, and as you're holding your camera, you move a little bit too. So if you decrease your shutter speed too much to make your image brighter, you're gonna see this blurry image, an image that's not really focused. That doesn't really become a problem in dental photography because we're using flashes, but we'll go into that detail later when we talk about flashes. Now let's talk about the aperture. Aperture is a little adjustable opening that you have on the lens where the light travels through. So in the low aperture setting, that little adjustable diaphragm that's located in your lens has a big opening in the low aperture setting. And as you increase your aperture setting, that opening gets narrower and the less light will go through there. So in high aperture setting, you're going to get a darker image, and low aperture setting, you're going to get a brighter image. So this is the example photos that we took. As you notice, as we move from f3 to f20, the image gets darker. Just like the other two settings, this also has another effect on the image. If you pay attention to these numbers here, in a low aperture setting, the area that's in focus is very narrow, but as you increase your aperture setting, your more area is in focus, and this is called the depth of focus. So if you want a high wide depth of focus, you have to increase your aperture setting. So this applies on the dental image as well. If you notice that the front teeth are perfectly in focus, but the back teeth are little blurry, and that's out of focus. So in generally speaking, most people want the posterior teeth to also be in focus. So you want you don't want to open up your aperture too much. You don't want to go down on your aperture setting too much. If you do that, you're gonna have a very narrow area of your image that's in focus. So that's the aperture. Okay, so let's talk about the flash photography now. And so far we covered 3 settings that you can control to control your exposure. And let's go over them one more time here. ISO, if I ask you what ISO setting do you want to use, you might say, I don't want to use too high ISO, I want to use low ISO so I don't get those noisy fuzziness on my image, so I'll put low ISO. If you do, if I ask you what kind of shutter speed you want to use, I would say let's use a fast shutter speed, because you don't want to have that motion blurring effect here. So I use the fast shutter speed. And for the aperture, I want most of my image to be in focus, so I want to use the high aperture setting. And what that really leads to is the dark image. Okay, so let's take a look. You get an image like this. So how do we correct this? And that's where the flash comes in, and you can make the image brighter and make it look like this. So there is a fourth factor now. Now we're introducing the flash, and this flash needs to somehow synchronize with the settings that you put on ISO, shutter speed, and the aperture, so you get a properly exposed image. And there are 2 different ways of doing this. One way of doing this is a manual way, and the other way is more of an automatic way called the TTL. Let's go through the manual one first. So how the manual synchronization works is that you measure the intensity of your flashlight either by using one of these flash meters. And what this does is if you just let go of your flash once and then it measures that light intensity and gives the ISO, shutter speed, and the aperture setting. That's going to give you the correct exposure. But this device is fairly big and it's designed to be used in a studio setting and the face. It's not meant to be used inside the mouth. So the way I do it is these days we use a digital camera so you can take a look at your photo immediately after you take it. So I just take a couple shots manually with the manual settings. And you might get image something like this, and this is too dark. You'll either reduce your aperture or increase your ISO setting. I generally recommend increasing your ISO setting first to make your image brighter. And I'll move the ISO up until you go to about 1600 or 3200. If if the image is still dark, then I will start to reduce my aperture setting. But what you're giving is you're gonna have the shallower depth of image. So some of the areas on your image might not be in focus. Okay, so you just a little bit, increase the ISO, still too dark, take one more photo, and then this is good. So general tips in using a manual way to synchronize your aperture and ISO setting with your flashlight is if you're using a twin flash, I recommend using the maximum flash output, which most cameras come up as 1/1. If you reduce it by 50%, it's going to say 1/2 and so forth. And also adjust your flash position first. If your image is too dark, that means you're not getting enough of a flashlight going into your subject. And most common problem that I find is that it's not enough retraction. So patient's cheek is covering the light path from the flash to the teeth. So I'll have the patient or assistant retract a little bit more when you take your photo. I generally set my shutter speed over 1/100. I rarely change that. And I like to shoot for the aperture setting above 22 so that most of the area of my image will be in focus. And I usually stay ISO of 800, or if that's not enough, I'll first adjust this to 1600 before I change my aperture setting. Now, if you're using a ring flash, that flash is more of a direct light. And if you're using a full flash output, that can be a little too bright. So I recommend using either 25% of the flash output or the 50% of the flash output. And you can adjust these on the flash control unit. And if you're using a twin flash, you can adjust that within your camera setting. Now, if you're going to use the more of an automatic way of detecting how bright your flash is, you can put your camera into a TTL mode. What it does is it measures the flashlight. There's a sensor right in front of the film, and that detects how bright that flash is, and it can adjust the aperture and ISO setting accordingly. But this my experience, it doesn't work that well. Sometimes it works, but most times the image is either too bright or more often it's too dark. So it's easier if you use the manual way of doing it. Okay. Now, before we move out of this section, just one recommendation is to don't set your shutter speed faster than 1/250. What happens if you do that is that there is the duration of flash that goes off. So let's say that your flash is going off for 1 second, but if your shutter speed is only half of a second, you're not going to capture the entire intensity of that flash, and you're going to have like a dark image or some cropped image. And it's very difficult for the camera settings to sync when you set your shutter speed to too fast. So let's say over 1/500 seconds. Then camera has difficulty syncing the flashlight and the camera shutter. So just as a general guideline, don't set it faster than 1/250. This is why I usually never change my shutter speed setting. I just have it at 1/100, and that seems to work fine for me. So let's talk a little bit about the flash itself. I want to talk about two things here. One is guide number. One is the difference between hard and soft light. Guide number is some standardized way of measuring how bright your flash unit is. And if you go on to the online and search different flashlights, it's gonna have this guide number listed in the specification section. So this one in particular has the guide number of 33. And if you look at a bigger flash, this has a guide number of 92. So this is a much brighter flash unit than the one with a guide number of 33. And what this translates into is that guide number 92 means that when you have an aperture of 1 and ISO 100, you can properly illuminate the subject that's 92 feet away. Now, if you want to use higher aperture, then this significantly gets reduced. So let's say that I want to use the aperture of setting of 25, then you can only properly illuminate the subject that's 3 feet away. But keep in mind that this is when you don't have any light modifiers on your flash unit, and light modifiers are some things that can go onto your flash unit so that you can change the characteristics of that light. And this leads to our second section, which is a hard and soft light. So there are basically two different characteristics of light, one being a hard light and the other is a soft light. And the difference is how diffuse the light source is. Hard light is, if you can compare it as to if you're right underneath the sunlight, and soft light you can kind of compare it as if you're underneath a cloud where light is more diffuse, it's coming from different angles, and that gives a little bit more of a pleasing look, more of a studio quality lighting. So here's the example. This is the image that was taken using the hard light. You can see the spotlights of white flashes on the central incisor, specifically a little bit on the gingiva and the lower anteriors as well. Another image with the hard light, you can see that white spot in the middle, and image looks very like harsh, okay? Now, if you put something, we're going to talk about what we're putting in front of our cameras that can transform this image to something like this. So this is the flash unit that produces soft light. So we put diffusers in front of these twin flashes. Then you can change the characteristics of that light to more of a diffuse and soft light. Another example of the soft light. There's another example here. So this makes to me it makes the image look more appealing, more nice to look at. Now there are some people who disagree with me. I just want to see everything clearly. Then go for the ring flash. I have no problem with that. Taking photos is still better than not taking it. So. But this is more of a trend on social media, and when you show this picture to a patient or to your colleagues, and they get inspired of what you're doing. Okay, so it's all about the quality of light. Okay, hard light. In the hard light, the light source is very small relative to your subject. In the soft light, you're bringing the light source closer to your subject and make it big so that you get that diffused lighting effect. So here's the example. This is, let's say, a typical flash unit that's on your camera, and you're taking photos like this. This will produce a very harsh light because the flash unit is far away from your subject and it doesn't have any modifiers. Now, one thing that you can do is to bring this flash unit closer to your subject. Then that's going to give you more of a softer light because relative size to the flash unit to the subject, it's now getting bigger. You can go even further and put some sort of light modifiers on your flash, and that's really gonna make this flash as a big lighting source, and that's gonna make the light much softer. One downside about using the ring flash is that you cannot put light modifiers on your ring flashes. That's why I don't use them in generally. I like to use twin flashes that can have this light modifiers put on. So that's one thing about the difference between the twin flash and the ring flash. So what are these light modifiers that I'm talking about? If you go to an online retailer and then search light modifiers, there are different kinds. And mainly we're talking about the soft boxes here. And most of these are designed for studio lights, but there are some that you can put on the twin flashes. And these are the list of them. When I first started out trying to take the high quality dental image, I tried many of these. I think I almost tried all of them, and none of them works. I was never able to get the photos that I'm getting these days. And me and my colleagues and some of my instructors were trying to figure out how we can make this light more diffuse, more soft, and we came across this polyethylene styrofoams. And we started out with a paper, but then we switched to this styrofoam because it worked a little bit better. And I had it with me here. Basically, what you do is you can cut this styrofoams in about letter size paper, and you can put it around your twin flashes, and that's gonna make that twin flash. I have a twin flash here too. This is a twin flash. The light size of this twin flash is very small, but if you place this in front of it, now suddenly you're gonna get a much bigger light source. So that's how I do it. And the advantage of doing it this way is that you can point your light a little bit away from your subject. So even if you still got this foam right in front of the flashlight, if you shoot it directly to your subject, you're still gonna get that hot spot or that highlight on your image. The key is to point this flashlight a little bit away from the subject and also use this styrofoam, then that's going to give you a really diffuse light. And you don't have to use this styrofoam. You can start out, you can get some art papers on the art shop, and you can put it around on your twin flashes, and you can work like that. So here is my setup. I put Velcros around my bracket. So bracket, you also need a bracket if you're going to do this. Bracket is something to hold your twin flashes in different directions, in different ways. Like I said, I have this pointed outwards, and I put Velcros around this lens hood that I put on. I put it one on the bracket, one around the lens hood, and I put the styrofoam like this. And this is the brand of the styrofoam that I'm using. It's very cheap, about $8, and you can make many of these. So if this gets worn, so throw it away, make another one. Okay, so this is my current go-to setup in taking intro photos. Now, there are different type of flashlights other than the ring flash and the twin flashes. There is something called monolights as well. And what these are is it's more of a studio light, and these are great for taking extra photos and lab photos. And the benefit of using them is you can really get a good, gentle, like soft light, and it reduces the weight off of your camera because now you don't have to hold your flash units and the flash brackets mounted to your camera. But the downside is that these are fairly big and you need a space. And entry level monolights, studio lights are about $200 per unit, so it's not crazy expensive. And entry level ones are, even the entry level ones are really good for taking some of the extra photos and lab photos. So these are the images that I took using the monolights. Like I said, these are great for taking lab photos. There's another one. There's another one. Another one. Okay. So that's it about the flashes. Now let's talk a little bit about the white balance. You probably have seen symbols like these on your camera, and they represent what kind of lighting situation you're in. So if I took a picture of the white wall and you see this photo, you'll probably say that that's a white wall. What about if you see an image like this? Is this a yellow wall? You don't know because it might be a white wall with a yellow light on it. So that's what white balance setting can correct that. Okay, so depending on what lighting situation you're in, if you put up proper settings there, you can, camera will automatically correct the coloring and give you the proper color. So images like this, if you don't have a proper white balance setting, you're gonna get image something like that. So how you correct it is you can either use this gray card. It's called a gray card. It's a neutral card, neutral color card. You can buy these. They are fairly cheap, and every camera has its settings where you can take the photo with your flashlight pointing at this gray card, and camera will automatically adjust the coloring to the correct color. Because you're using a flashlight, and if you're using light modifiers, the colors can change a little bit, so it's kind of important to use one of these and to color correct it. If you don't have one of these, what I recommend is that if you go back here, you have different settings. One all the way to the right is a custom Kelvin temperature setting. So K setting is that if you go low on the number, the image gets colder and more bluish. If you go higher on this number, image is going to look warmer. So you can go into the Kelvin mode on your white balance and then take a couple pictures and see how it comes out, and you can set it to the white balance setting that you like. Currently, when I'm using my custom setup, my Kelvin setting is about 5,600. Okay. Lastly, I want to talk about the macro photography. Dental photography is I consider it's part of the macro photography. And I do want to talk about the different lenses, different focal lengths, and I do want to talk about the minimum focus distance. Let's first talk about the focal length. It's the distance from the focus point to the film. That's a more of a exact definition of it, but let me explain a little bit. So what lens does, a lens is focusing the light to the film, and at some point it's gonna light path is gonna cross, and we'll have that focal point. That's what you see on the middle of that lens, and the distance between that point to the film is called the focal length. Now the standard lens has a focal length of the 50 millimeters. If the lens has higher focal length, that means it's a telephoto lens. And for the telephoto lens, you can be a little further away to get the same image compared to the standard lens. And if you have the wide lens, which has a very short focal length, then you're gonna have to be really close to the subject to get the same framing of that image. So basically, all you need to know about this focal length is that if you have a higher focal length lens, you can be a little further away than as if you were to have the shorter focal length. And here I do want to talk about the full frame body versus the crop frame body, because that has to do with the focal length too. The most expensive piece in your digital camera is the digital sensor. And when DSLR first came out, it was very expensive and difficult to make the digital sensor. So what they did is they made the sensor a little bit smaller, like this. So now imagine that you're using a lens that are designed for the full frame sensor. But if you are using a smaller sensor, it's not going to capture the entire image. It's going to capture only the center portion of that image. And that image will look as if it was zoomed in a little bit. So the image with a same lens on the full frame sensor might look like this. If you crop down the size of the sensor, it's going to look smaller. And these smaller sensors are referred to as APS-C sensors, and those are a little bit cheaper than the full frame sensors. So if you do this, you're going to have, again, more of a zoomed in effect, and you can kind of correct this on your lens focal length. So the effective focal length, if you're using the crop body, is 1.5 times higher than your full frame body. So let's say that your 60 millimeter focal length light used on the crop body will be more of a 90 millimeter, and 100 millimeter focal length lens will turn into 150 millimeter on the crop body. There are generally two types of macro lenses, one in 60 millimeter, one in 100 millimeter. 60 millimeter one, you'll have to be a little bit closer to your subject, but it's a little bit lighter and less expensive than the 100 millimeter one. And the reason why we have to use the lens that is designated as the macro lenses are because macro lenses have a shorter minimum focus distance. So the minimum focus distance is the distance between your subject to the front of your lens. And if you look at two similar lenses, one being a macro lens, one being a general like standard lens, you can see that the macro lens has much shorter minimum focus distance compared to the regular lens. And this is what you need if you want to take the dental photographs. Okay. So that's it for the basics of photography. We talked a little bit about the composition, how we can use rule of third. We talked about exposure, the three settings, ISO, shutter speed, and aperture. We talked about flash photography, how you can synchronize that using a manual mode. And finally, we touched upon the macro photography and why you need to use lenses that are designated with the macro designated as the macro lenses, and talked about the minimal focus distance and two different types, 60 millimeter one and 100 millimeter one. Let's talk a little bit about the dental photography now. First, let's go over some of the equipments. And there are three equipments that you need. You first need camera and lenses. You'll need a flash, and you need some sort of dental instruments that can help you take dental photos. Like I said, what's more important than getting the gear is knowing what the settings that you should be looking at, what settings you should change, but you cannot take photo without the camera. So let's go over them. There are two major brands. One is Canon and Nikon. Both of these companies have been there for many years, and you cannot go wrong either one of them. I personally have Nikon cameras, but you can buy Canon, and they have so many models. And which model should you be looking at? Basically, you can categorize them into two different cameras. One with a full frame sensors, like I said, and one with the smaller sensors. Those are referred to as APS-C sensors. And I went online and got most of the major models from their companies and then listed them here. So you can use this, you can screen capture this if you want, and kind of go for the camera that you want. Out of the full frame sensor ones, for the Canon, I would try to go either D6 or D5. For the Nikon, D850 is really good camera. It's been praised for one of the best cameras out there. It has the difference is that it has a really good sensor with a high pixel count, so that even if you crop your image is still gonna look beautiful. Now let's say that that's too much for me, that's too expensive. You have to consider that these are the prices without the lenses, just the camera body itself. So if that's too much, I started out with a smaller crop body sensor as well. So I will either go for like a T7 on the Canon or T7500. That's another popular model in the crop body section. Okay. Let's look at the lenses. You also need lenses on top of the camera body, and these lenses you cannot mix and match. So you cannot buy a Canon body and use Nikon lenses, and you cannot use the Nikon camera with the Canon lenses. So once you're into that brand, you got to stick with it. And both companies make 60mm and 100mm macro lenses. And the prices are a little bit cheaper on the Canon side than the Nikon side. It has always been like that. Don't know why, but they both work great. This is my camera setup. I have all of these. I started out with the 7500, then I moved towards the D750. Because D750 and 100mm lens is a little bit on the heavier side, if I have both of them laying around, I will generally grab the bigger one for the restorative documentation. If I'm doing any surgical procedures where I want to grab my camera a little bit easier, then I might use this D7500 on the 60mm lens. I use that because D7500 is a smaller sensor, so that it's going to have that crop factor. So 60mm lens is going to turn into 90mm lens, and you can get a little bit zoomed in effect using 60mm one on the crop body. Okay. So, but I really like the 750. Now there are different category of cameras that are available these days called the mirrorless cameras. What they are is they don't have this mirror component within the camera body, so the cameras are going to be much smaller and lighter. The only downside of these is that they're fairly new and they have a specific lenses that can go with them. So the mirrorless lenses cannot be used with the regular DSLRs. So Canon only has one lens that can fit in, one macro lens that can fit into that, and that's 35mm, which is not good for dental use. I recommend either 60mm or 100mm one, and Nikon doesn't have one. You can buy these lens adapters that you can put on, but those has some compromises in autofocus features, so I will generally stay away from that at this point. They might have more selections in the future. At that time, we can consider using them. Let's talk about the flashes. There are three types that we talked about. One is a ring flash, the other is a twin flash, and lastly, there is monolights. So let's talk about the ring flashes. This is a really good one called made from Nissin. Generally, the price range for the ring flashes run from $100 to about $500 in more professional grade ones. And the advantage of using them, it's easier to use because you don't have to manipulate a lot. But the only disadvantage will be you cannot put like modifiers and you cannot get that soft studio quality lighting here using this one. So again, the difference, if you're using a ring flash, you can only get the photo that you see on the left side. So twin flashes have advantages that you can manipulate more and you can make your custom light modifiers and put it around them to improve your quality of your light. These run on around like $170 per unit. And if you're going to use this, you also need a flash bracket. I'll show you that later. The disadvantage of twin flash is that because you have to use flash brackets and you have to have two of these, it could be a little bit on the heavier side, and there's more to adjust to get a proper exposure using these. Lastly, let's talk a little bit about the monolights. These cost about $200 and the entry-level ones. The one that I listed here is the one that I have. It's fairly good, it has a good syncing technology between your camera and this monolights. It's fairly good and it doesn't cost too much. And you can use these to get really good lighting, and especially if you're going to take a lot of dental photos and extraoral photos, I recommend getting these. These are fairly good for their price, and you can get really high quality photos using them. Only disadvantage is that if you're going to use this, you need some space to take photos. So if you have extra set of chairs that where you take all your initial photos, you can set it up there, and then you can just use your regular camera when you're doing procedures. But for the initial and final photos, maybe you can bring the patient to that extra chair that's set up for taking photos, and then you can have these set up and take photos like that. Now, dental specific instruments, like I said, if you're going to use twin flashes, you need brackets. And there are two major brands that makes dental brackets. One is from Photomat. This is the most common one that's being used at this point. And they run around $300. And if you're going to use twin flashes, this is something that you have to get. Okay. Mirrors. Mirrors are important. If you're going to get a occlusal shot, I recommend getting mirrors. I only have two sizes, one adult size, one adult wide size, and these two tend to fit most of the patients. So I like to use the mirror that has handles. And that's because I don't want my finger holding the mirror in the photo or your assistant's finger holding the mirror on the photo. So it's always good to get something with a handle so the finger that's holding the mirror is not in the frame. And I usually get one occlusal photo and then one for the side shot. And often if you're doing some procedures, if you're doing like a preparation, you want to get a occlusal aspect of that tooth, these side mirrors are pretty good rather than using the big occlusal photos and getting that couple teeth in frame. Okay. Now, if you have tried this before, whenever you put mirror into a patient's mouth, you get fogging, and that's because your mirror is cold and your patient's mouth is a little warm. What you can do is you can warm this mirror up. You can either use warm water, or you can buy one of these mirror heaters, and that's gonna warm the mirror, and then you're not gonna get that fogging. If you don't have time and time to warm it up, you can just have your assistant blow the air on the mirror, but that requires another hand. But the most expensive equipment, all the cameras and lenses, are not going to give you the best photo. What's going to get you the really good photo is these retractors. And I have 3 of them that I'm using currently. The first one is a regular universal metal retractor. And then I started using these self-retracting retractors. They are especially helpful if you're taking the frontal shots, because if you ask your patient or your assistant to retract the cheek, they are always retracting one side more than the other. And if you take a photo, one cheek is a little bit in the frame, the other is not. So if you use one of these self-retracting retractors, you're going to have even retraction both left and right side. So I recommend them. The plastic one on the bottom is good if you're taking the anterior shots with the black contrastors. I will show you how we use those. Contrastors are good for getting the anterior shots. It's gonna make the background black, which is gonna help focus the viewer to focus on just that one tooth that you're working on, and you can get the image like this using that. Okay. So that generally covers everything. Now let's talk about the documentations. And I'll give you, we're gonna look at a bunch of photos that has all the settings that I used to take that photo. And it also has the unedited, the original shot that I got and how I cropped them. Okay, so starting with the extraoral photos, these were taken with the monolights that you saw. And these are the 4 set of images that I take in the initial visit. I take it with a closed position, repose position, smile position, and big smile, exaggerated smile position. It's good to have patient close their eyes and then smile really big so that you can get what the exaggerated gum line looks like. And the settings that I use here is 1/160, f/29, ISO was 100, because these monolights are very powerful lights, so that you can go down on your ISO. And these are the unedited photos. They are pretty much same as the final photos. I do the same with the lateral photos. When you take the lateral photos, it's always good to have patient looking to the right. Generally, people are used to looking at the photo from left to right, not right to left, because that's how we read. So if you have your patient looking left, it just doesn't feel right. It feels more natural if you place the profile photo looking at the right side. So this is a little tip that I use. And these are the original photos. They're pretty much looking the same. And with the monolights, I also take a closed-up smile photos as well. And because they can give a very good diffuse light, the settings are the same. And then I just move closer to my subject and take these 4 set of photos. And these were the unedited ones. It's better to frame the photo a little bit out so that you can crop a tiny bit. If you take the photo really close in, then there's no room for cropping. So that's that. Let's take a look at the intraoral photos. These are the initial set of photos that I take intraorally. Frontal shot, 1 posterior lateral view, edge on the left and right side. And these were the original photos that I got. Especially when you're taking the posterior teeth lateral view, it's good to frame it a little bit further out and crop it in. If you are really close and frame it right away onto this lateral view of the posterior teeth, it's a little bit difficult to adjust your light so that it gives enough light to the subject. So for the lateral posterior shots, I take a little bit away and then crop it down later. Occlusal shots are the same. The settings are listed there. And these were the original ones. And let's look. I also try to take the lateral occlusion and medial occlusions, left lateral occlusion, right lateral occlusion, and these are to see if you have any posterior interferences. And these were the original photos. If you want to be more picky about it, you can take these excursive movements looking at the posterior lateral view, but posterior lateral views are very difficult to take, and if you have patients try to go forward, left to right, could be a little difficult. And if you can see it from the frontal shot that no teeth are touching, then I'm fine with that. Okay, so let's take a look at the restorative procedures that I documented. This is the anterior implant crown try-in and delivery photos. When you take these frontal shots, it's always better to exaggerate the curve of SPE, so the occlusal plane is going up on the posterior part, so you don't have this occlusal plane going down looking a little ugly and not pleasing. So always try to exaggerate it and have the posterior teeth going up like this. And these were the unedited original photos, and you can get the images like this. And it's about telling the story. So it's when you have photos like that, this is very easy. So these are the preparations. And now we can place the left side gingival architecture and have these abutments placed in and final restorations placed. And we can take a look at the left side, the right side here, and the left side here. So these are the original photos here. The settings are listed there, and one more frontal shot like this. Okay, so these are all the original photos without any edits on them. And these are type of pictures that you can get if you use this custom diffuser and a twin flash and a twin flash bracket. Let's look at the posterior teeth prep. Obviously, these are cropped a lot. I use these lateral side view mirrors to take the occlusal shots on the posterior teeth. And if you're only taking a couple teeth, it's easier to use this rather than using the full big occlusal mirror. And always try to keep the frame consistent so it's easier to put together later. And these were the original photos. And you can get the left photos like this. Settings are there. And these were the original photos. So some tips about restorative procedure documentations. Get close enough, but frame it so that you can crop it later. Do a good retraction. Consistent angle and framing is key when you try to put together the images. And know the key steps to take pictures. So I always try to take it at the initial one, then I try to take it once all the cavities are excavated. I take it one more time when the preps are done, and then you can take the final photos and the final impression photos. Let's look at the surgical procedures. Implant placement, number 18 and 20 with simultaneous bone grafting. This is the autogenous black bone graft. So every patient is different. I was a little bit lucky on this patient because this patient's cheek was very mobile and I could retract really well. So if you get a good retraction, you're not going to have trouble with getting high quality images. It's more difficult if your patient's cheeks are very not retractable. Okay. So original photo looks like that. Even if you crop it a lot, if you use the full frame sensor, if you have more of a modern camera model, you can do a lot of cropping and still get the good quality image. This is the bone sections and harvested. And these were taken, how do you get these type of photos? Is that I try to hold this piece of bone and then just use a black background. My assistant wears a black scrub, so I have her turn around and then hold this piece of bone very close to the lens and take the photo. Because the twin flashlight is not very strong, it's not going to illuminate the background. So regardless of what background you have, if you hold your subject close to your lens and your background is far away, then you're gonna get a black background, even if you don't have clear black background. So that's one key thing in getting these type of photos. And same for the lab photos as well. Other photos like this, and here going around, you can see that the motion blur happening on the slow shutter here, 1/80 here. That's that. Where's block nerve? Place the implants. Place the block graft. 4 months later, you can see that the bone growing in. And these were the original photos. Okay, surgical documentation tips. Use a smaller camera setup if you have another set, and get close enough, but also frame it so that you can crop it later. Consistent angle and frame is also key here, and know when to take the pictures. And lastly, don't compromise the patient care. So if you're controlling the bleeding, don't try to take a photo you're trying to control bleeding and stuff like that. Okay, general senses. Laboratory procedures. It's good to have monolights here to take lab photos. These were the settings here. And monolights are great if you want to take picture of this large subject like articulator here. These were the documentation of how I do cross mounting. So these were the original photos. And final impressions, pretty much same. Like I said, you can try to hold your subject close to your lens and then have either the floor or the black background far away from your lighting source, which will be your twin flash. Then you're going to get either black background, or if you have some sort of a light panel behind it, you can get a white background like this. Okay. And this is a black background. Just hold it with your hand. You can also use the black acrylic and lay your subject, lay your impression on there and take a photo using that. That also works. And these were the original photos. Now let's take a look at the final restorations. These were taken using the black acrylic background, and you can see some reflections here happening here. These were all taken with the monolights. Okay, and the settings are listed here, and the unedited original photos are shown on the bottom here. Okay, so give you all the settings. If you have the right setup, you can take the images looking like this. If you use a custom-made diffuser or the monolights here. Okay, laboratory documentation tips. Always try to use a lower ISO. It's easier to take lab photos because you don't have to worry about the retraction. There's no chick that's blocking your light. Consider using tripod so that you keep the consistent framing. Bigger object may need a bigger light source than the twin flashes, maybe monolights. And it's always more interesting when you take some action shots. Okay, so that is it for the lecture portion of this. Dr. Koo is gonna go over some of the setups for the Canon cameras, and I'll show you the video of how I take my initial set of photos, and also give you some little tips that you can see when you're taking any intro photos or the external photos. Okay, so with that, we'll give the screen to Dr. Koo.
All right, thank you, Dr. Jang. I remember that lecture being about probably like 3 hours long when we did the offline course, and she did a great job on condensing that. That took about an hour, I think. So,
Yeah, hour and 15
all right,
minutes.
awesome, awesome. I bet all the doctors are appreciating that after a long day of work today. All right, so let me show you. So Dr. Jang is using Nikon, and I happen to use Canon. And this is the question that everybody asks. What should I get, Nikon or Canon, right? The only reason why I ended up with Canon is I inherited my father's old camera that he was using. My father is also a general dentist. And I started using that. And so I just didn't want to throw out the macro lens he gave me. So I ended up continue on the Canon side. And I mean, to be honest, I've been satisfied. So here's my setup. I mean, it looks pretty similar to the Nikon setup that Dr. Jang has. I mean, this is exactly what he taught me. He helped me to come up with setup, and I've been very, very happy with this. So the camera that I mainly use is EOS 80D. It's not as high end of a camera as what's available out there. But this one, I'm happy with this so far. I may upgrade it sometime in the future, but so far so good. And this is a macro lens, 100 millimeter, that I inherited from my father. I think it's discontinued. I don't think they sell it anymore. They have newer version of this. And this is a speed light. This is a twin flash that goes on. And one thing to tell you about this is that this speed light, this twin flash, is actually slightly bit larger and takes bigger batteries. So the flash output is also a little brighter. But at the same time, because it takes more battery and it's larger, so it is actually a little more, it's on the heavier side. And one thing I want you to notice is, I wish I had a side-by-side view of his setup in mind, but basically, with the Nikon, with his setup, with Dr. Jang's setup, his flash will be lying somewhere near here. It will be pointed more towards the front of the camera, whereas Canon, I have to put it a little more towards the back. Again, that's just the output of the flash is just a little bit brighter. I tried in the beginning to put this flash right in this spot, and I was just getting hard light. And we were trying to figure this out, and turns out I just need to make this diffuser a little larger and point the flash a little forward to the back so it bounces off and goes to the front of the camera. So there's always a way to tweak things. So if you have, I'm sure some of you guys might have different companies, and if you're not just getting the nice diffuse light, try to change the angulation, try to change the size of the diffuser. and you might find the point where you might really enjoy your photos on. So there's not there's no solution that fits all. Okay, and as Dr. Jang mentioned as well, I also have a different setup for my surgical photos. This one is a crop body. It's a Rebel P6 with a 60 millimeter lens with a ring flash. Super light. I can grab it, go, and point and shoot during my surgeries. Much easier. Unless I'm trying to take some artistic photos during my surgeries, this is my go-to for my surgeries right now. And I can show you. I'm gonna show you some of the example photos, and whether the quality of the photo looks, I mean, they may look a little different from Nikon to Canon. That's what I hear most of the time. But I mean, but you be the judge. If you already have a setup, don't feel pressure to go with what the other company just because that's what other people are using. You can tweak your camera to make it look much better. So this, I mean, all these photos, I've taken these. This photo was taken with the monolight, just two implants side by side. The monolight is just very fun toy to play with. Dr. Jang introduced me to it, and ever since I've been just trying to take pictures of some random objects as well. It's a lot of fun. Extracted third molars. So as you can see, the light just seems to be a little on the hard side, and this was when I had my flashes pointing a little more towards the camera, so it's a little more diffused, right? So it all depends on the little tweaks that you can make. I'm trying to do a custom shade for this implant crown. Much more diffuse light in this case. Graph taken from tuberosity. So yeah, if you are looking to purchase new set of cameras and flashes, be my you make your own choice. But this one is with the ring flash. You can see the hard light with the hard surface with the highlights on the teeth surfaces. It's not as soft. This is softer, right? So, and the way we use the semicircular retractor with the contraster is like this. I just took a side photo of it just to show you how we use this, but we'll also go through this in the video as well. Yeah. Yep, so these are some sample photos. So if you have Canon and just seems like your photos are not coming to life, it's probably because you just haven't found that place yet. And this is a photo that I took with actually LED lights. This was right before I got my twin flash with the diffusers, and it gives some interesting characteristics. You can actually see it's not diffused, but you see those little speckle, like kind of looking highlights. So LED light, you can play with this, but it just doesn't. It's not the kind of light that we're actually looking for. But it's fun to try different lights. There's my Instagram, and so let's go over to the video. We were very fortunate to have my hygienist volunteer as our model, who happened to be the best patient that you've taken pictures of, Dr. Jang?
That is correct. She was the best patient. Very easy patient to take pictures.
Yeah. All right. So, all right. Let's get to the video.
in the demo section of this webinar, and we'll actually show you how we take our initial set of photos, starting with the profile photos, and then we'll move down to the intraoral photos. Okay, so we have these three soft boxes here. I aligned them like this, so the back one is right behind the patient's face, and that's gonna create the background that's clear and white, so you don't have any shadows, okay? Then I set two of these soft boxes that I talked about earlier right next to the patient's face, as close as possible as you can. Like I said, the closer you get your light source to be, you're gonna have more diffused and more gentle light compared to the harsh and very strong light. The settings that I'm using for this is ISO 100, f22, and shutter speed of 1/100. Let's take a shot and then we'll see how it comes out. I tell my patient that we're going to take 4 set of photos. First one will be everything closed, mouth closed, teeth together. Second photo will be relaxed photo. This is the most important photo that we should have. That's going to tell how the incisal edge is positioned according to patient's face. So I have patients swallow once and then drop their lips a little bit slightly and then show that little incisal edge. The third set of photo will be a smile photo, and the fourth one will be a big smile. Close their eyes, bite your teeth together, and smile as big as you can. So let's go through the sequence. First one, just close everything closed. Yeah. That's good. Now second one, relaxed position please. Lips slightly apart. There you go. Okay, and then we're gonna do the third one. Bite down and give me a little smile. Good. And then last, we're gonna do close your eyes, bite down, give me a big smile. There you go. Perfect. Okay. Now let's have our patient move 90 degrees facing to your right. Okay, a little more please. Alright, that's perfect. And we'll take the lateral shot like this, okay? If you can slide your chair back a tiny bit. Little more. Perfect. We'll go through the same sequences, okay? Close your mouth. Perfect. Relaxed position. There you go. You can turn your chair slightly to the right. Perfect. Okay, and then now we're gonna do a small smile. Okay, bite down and give me a big smile. Alright, perfect. So that is the initial set of profile photos that I take. Now we can take a little zoomed in photo of the patient's smile, and then after that we're done with the soft boxes. Okay, now I'm doing the same thing, but I'm just zooming in a little bit, focusing only on her mouth. Okay, a little closer. We're gonna go through the same sequence again. Relaxed position. Little smile. Big smile. Alright, that is it. Okay, so now we're taking the intraoral photos. We don't need this anymore. This is the commander unit that hooks onto your camera that controls those soft boxes that we saw before. And now we don't need this. We're gonna use a twin flash now. I have it mounted on this bracket that we talked about earlier. This allows me to point my twin flashes the way I want them to. And I can also put some custom-made diffusers around it so we get that soft light effect. Okay, let me go ahead and put this on here. Okay, it's hooked on. Now I use these two soft boxes that I created with polyethylene styrofoams. I'm gonna put those on. I have velcros around those brackets here. And then now it's on. When I use these trim flashes, I gotta have this on-camera flash on, and if you shoot it like this, you're gonna get some hot spots coming from this flash. So I use a little flash blocker right on top of it, so it blocks out this flash, but these two twin flashes will go off. Okay, so this is my setup that I use. It's fairly small and it's manageable. I know it can look a little bit intimidating at first, but this really gives a good photo, okay? Let's go ahead and get started. Alright, so now we have our patient lying down. First set of photos that we're gonna take is the frontal shots. Okay, for those shots we need these two metal retractors. We'll have our patient retract herself. You can bite down and hold this out for me. Perfect. I grab my camera. The settings that I'm using is ISO 600. Shutter speed will remain the same, 1/100. And for the frontal shots, I'll try with the f/22 first. Okay. You can retract a little more for me, bite down. Okay, that was too bright. I'm gonna go down on the ISO. And also adjust my flash positions. Still too bright. Gonna move down the aperture to 29 now. That's pretty good. I'm gonna take one more with a higher aperture setting one last time. That looks pretty good. Now at this position, I'm gonna ask my patient to go protrusion, lateral protrusion, and medial protrusion, so we can get those excursive information as well. Grind your teeth forward. Perfect. Stay right there. Okay, go back. Grind your teeth to the right. Perfect. That was a little too much. Go back a little bit. Perfect. Okay, and then bite down. Grind your teeth to the left. Nice. Okay, so that's it for the frontal shots. Okay, so now we can get those beautiful interior shots with the black contraster right behind at this point. For that, we're going to use these plastic retractors. They work really well for that purpose. So I'm going to put this on. There you go. I'm going to use this matte finished black contraster. Perfect. Maybe we'll use the bigger end here. Nice. Good. Then I'm gonna have my patient to pull the retractor as much as she can. There you go, that's good. Perfect. Then now I'm gonna come from the behind. Okay, open tiny bit. There you go. Not too much, but just a little bit. Nice. That is it. So next, we're gonna take the occlusal photos. We'll go back to these two metal retractors. take the upper first. For the upper, you want to position your retractors like this. And then for the lower, we'll go, for the lower, we'll go down like that, okay? So starting with the upper, we'll position like this. We'll have our patient hold the end of the retractor. Perfect. And then we'll use this mirror with a handle. I really like this. It has a long mirror. You can hold it towards the end, and your hand is not going to be in the way of your photo. Okay, I hold this. My setup, now I gotta go down on the aperture. I'll go down up to f16. Then we'll stay with the ISO 400 and shutter speed remains the same, 1/100. Okay, open a little bit, perfect. And I hold it with that. So the goal of the retraction is to have her cheeks off of the teeth. So if you can pull forward a little bit, perfect. Breathe through your nose. We'll take one more. Open for me. Nice. Okay, now we're gonna do the lower. We'll have our patient hold it down like this. Perfect. Okay, open. I'm gonna put the mirror underneath your tongue. Perfect. Stay just like that. And that's good. Now the only remaining photo that we need to get is the lateral shots. This will be the most difficult photo that you will need to take. For this, I use this lateral shot mirror with the handle that's bent away so patient can hold this, and it also helps with the retraction. Okay, so we put one retractor, one metal retractor. We're going to use this mirror. I'm going to have this like that. And bite down for me. Okay, if you can hold the retractor and the mirror hander, that's good. Okay, so now though I gotta change my camera setup a little bit. I'm gonna take a photo like this, and this flashlight should point outwards, and I want to turn this a little bit forward so that it shoots more direct light to the mirror. If I turn it like this and take it like my usual setup, it's not gonna have enough light going to the mirror. That's what I've been finding. So for the lateral shots, I move this flash pointing a little more directly to the mirror. Then I take a shot. It was a little too bright, so I can adjust this flashlight to go outwards a little bit. Okay. Always try to adjust your flashlight before you change the any of the aperture or the ISO. And that's good. Okay, the reason why we don't have the set setting for all the photos is because every patient is a little bit different. Some patients have a cheek that you can retract really well, then you don't need to have the high ISO. But if the patient has very limited opening, the retraction is not easy, then you gotta increase the ISO a little bit, and your flash positioning is gonna be a little bit different every time you take the photo. So that's another reason why we cannot tell you lateral shots go this ISO, this aperture. You gotta see how your photos look like and adjust accordingly. We're just gonna repeat it on the other side. Have this here. Have the mirror on the other side. You can bite down. Perfect. Hold this for me. Nice. Grab my camera. Now, if I'm taking a picture like this, I have the flashes set up the right way. This one is gonna point outwards. This one is gonna point a little bit more directly towards the mirror. That's good. Okay, so that was it with all the initial set of photos that you're gonna take before you start any big cases. Now you can use any combination of this to document your procedure photos. You got the basic skills now to take a good intro photos. And then we showed you how you can take the profile photos as well. So that concludes this demonstration. I don't know if any of you have noticed yet, but the unedited photos that I just showed you were not perfect. Most of them need some cropping and reframing, and some of them also need some minor enhancements as well. So I'll show you how I organize my photos and do minor edits. Some people like to just organize their photos in different folders, but as your patient pool gets bigger, this can be time consuming and also confusing. So there are several photo organization / editing programs out there that you can use to solve this problem. If you're using Mac, Sender Photos app is a great option. You can organize photo and do minor edits, and everything is synced to cloud, so you can also view your photos in iOS or Mac devices. And if you just buy some iCloud storage, it will give you plenty of room for all your photos. The program that I use is called Lightroom from Adobe. It has slightly enhanced editing options than standard Mac Photos app. It is also available both Mac and PC, so if you're using PC, I highly recommend using this program. A few years ago, Adobe made things very confusing by publishing two separate versions of Lightroom. Now there's Lightroom and Lightroom Classic. And these are two completely different programs. The main difference between two is that Lightroom is a cloud-based software, and Lightroom Classic is designed to be used with local hard drives. I tried both of them. I started out with using Lightroom Classic, and then I switched to the Lightroom, the newer one, cloud-based one, and then I switched back to the Lightroom Classic. The main benefit of using Lightroom, the cloud-based one, is that all your photos will be synced via cloud, so instantaneously it will be available on your mobile devices, which is good when you want to share your photos with your friends. But the main drawback was that I couldn't organize my photos the way I wanted to. Basically, I had to use the foldering system the software provides. So if I import the photos into the Lightroom, it will just automatically shoved into this weird foldering system within the software, and it was very hard for me to relocate my original photos. So if you're planning to organize your photos into your own foldering system and use your specific external hard drives to manage all your photos, then I recommend using Lightroom Classic. So let's import the photos that we just took into Lightroom Classic. And I'll show you how I organize them and also do some minor edits. Okay, so we will bring all our photos into the Lightroom. So I'll go ahead and start the Lightroom Classic here. Now I already plugged in my SD card from my camera, and I also plugged in my external hard drive where I put all my patients' photos into. It comes up like this. I already imported them, but we'll go through one more time. So we'll just disregard this, and then we'll start from the scratch. I already have 8,317 photos here. That's why it's taking a little bit. Plus I'm also recording, so computer is a little bit slow. Okay, good. So first thing that I do is I press the import button. It's Command Shift I, or you can also go to File and then Import Photos and Videos here. So click that. Now this is gonna pop up the window. This is the importing window. So what we're doing is we're importing all the photos into this program, and you can also tell in this classic version where your photos are gonna go. So on the left, this is the source panel. So this will be your SD card. Now if we go into this SD card folder here, and then this is all the photos that we took here. Now on the right side it's gonna tell you where these photos are gonna go. So on the left is the importing the source image. In the middle, you can decide whether you want to copy this image or you can move this. So you delete it from your SD card and move everything to this new designated folder. Or if you just click add, what that is that you're leaving the photos where it is. In this case will be the SD card, and you're just cataloging them into this Lightroom software. Almost all the times I just use copy to play safe, and once I know that it's in the correct folder, I go to the SD card and then just delete all the photos once I confirm that it's in the new location. On the right side, I go here, I always click other destination. Okay, if you click this, it's gonna show up the window. Okay, and then I go to my external hard drive, and on the bottom I have Lightroom Classic. This is where all my patient photos live, and you can create the new folder if you're seeing this patient for the first time. And then I'll say GDIA demo for this purpose. Then I click create. So this usually will be your patient last name and first name, and then within this patient called GDIA demo, click new folder one more time, and then I put the number first, and then say maybe an initial visit, and then click create. Okay, so as you continue to see this patient, you can put different folders there. Say 2 preparation, 3 final impressions, and so forth. So we'll just click initial visit for now and then click choose. So now everything is set up. You're gonna get your photos from this SD card. All these photos are gonna be copied into this folder that we designated and we just made. Okay, here I usually don't touch all this. This is where you can manipulate a little bit and also put some keywords there. I sometimes use this, so if I do a specific procedure, let's say GBR, I just put a keyword in GBR, and that's gonna tag all these photos into GBR, and later when you go into your library, you can just type in a GBR and it's gonna show up all the photos that are tagged with GBR. Okay, so that makes it easier when you want to put together a presentation or something like that. So I click import now. Now everything is going to be copied into that new folder. There it is. So now if you look on the left, you'll see your external hard drive name here. Then go down here, you'll see GDIA demo, and then initial visit. Okay, so these are all my photos. So that's how I organize it. As I say, if you want to find the tag photo, you gotta click the entire folder and then do Control F, and you'll see this search line over here. You can put like a block. I think I did some block bone graft. See, as soon as I click block, all the photos related to the block bone graft shows up. So that's an easy way to organize your photos. So let's go back to the GDIA demo into the initial visit, and then now let's go through these photos. So let's see. Now as you look at them, there is a way to mark the photos that you like, that you're gonna use, and then mark the photos that you don't want to use. I usually basically mark the ones that I want to use and leave the rest of them blank. So the way you do that, there's 2 different ways. You can pick the photo here, or you can give it a star rating. I just use the pick photos. The shortcut for that is P. So I think this is a correct photo that I want to use for the relaxed position. I just click P. Okay, flag is picked, and then you can see that it's highlighted over here. Go to the next photo by pressing the next arrow. I actually think these are not the photos that I want to use. Let me just go ahead and unpick that. So I think let's start from here. So this is the photos that I want to use. Pick, go to the next, pick, go to the next, pick, go to the next, pick. And this is the photo that I want to use. Pick, 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 pick. Speed this up. So if you press G or click this button, you can go back to this grid view, and then now you can organize it by your pick rating. So from here to here are the photos that I'm going to use. Okay, so let's go ahead and edit them. Before I do that, all these mirror images needs to be flipped horizontally. So I go here and select these 5 by pressing down the shift, and then go to the photo and then flip horizontally. Okay, that's all done. So let's go through each of them and then start the editing process. If you want to edit your photos, you got to go into the develop tab here. So let's click that. And the first thing that I do is crop them into the frames. So I click here, crop, and then I can rotate this. Okay, that looks good. And I want to bring this down here, and then bring this one something like this. Okay, that's good. Let's go to the right side. Do the same. Okay, so that's it. That's unpicked photo, so we're not going to worry about that. Let's go back to the grid view. So from here to here, everything is cropped into the proper proportions. Now let's see if we need to do some edits on the exposure and some minor edits on the shadows, okay, and highlights. Let's look at this photo. Obviously, the anterior teeth are a little overexposed compared to posterior teeth. So let's try to correct this. How I would correct it is we'll go back into the develop tool. We'll increase just this area a little bit. And then I'm gonna decrease generally because this I think is too bright. So here on the right side you have an exposure tab. You can dial this down a little bit, and then you can see that this side is looking much better. And then this, if you click this gradient tool, you can use this. You can pick what this gradient is going to do. You can either increase the exposure or decrease the exposure. Since we're gonna paint it on the posterior part, I want to increase the exposure a little bit and do it like this. Okay, so that looks a little better. There you go. That's good. leave it at that. Let's do the same on the other side. Another way of doing it is you can decrease the exposure and then paint it on the frontal teeth. There you go. Now the frontal shot, what I like to do is I like to bring this black down a little bit. So if you go onto the right side, you can see this black tab and bring that down, and it makes this black background really black. I don't know if you can notice, but sometimes when you take this photo, you can see that it's kind of black, but it's not black, it's a little grayish. That's when you turn this black tab down a little bit, and you'll get a true black. Don't do it too much, but just do it a little bit, and then as you notice that things are turning into the clear black, then you stop it there. Okay, so that looks pretty good. Same goes for these profile shots with the background. You can dial the white tab higher up, and then it will make these white background even whiter. Sometimes it's not completely white, it can be a little gray. That's when you do this. Go to the next photo, do the same thing, and then repeat all that. Okay, so other than that, I'm pretty much happy with how these photos came out. Then I'll press G to go back to the library. Now it's time to export this. So you can stop it here. All the edits that you do on the Lightroom doesn't affect your original photos. It's just added data within the Lightroom. So to see the effect of all the edits that you did and cropping that you did on these photos, you got to export them. Select the photos that I want to export. Click the first one, press Shift, and then go to the last photos, and then right click, and then there is export. Okay, and then you can just click export. And here I just put it on the desktop. I usually rename it to patient's name. So I'll say GDIA demo here. And then I usually start with number 1. So what it will do, it will rename all these photos into GDIA demo, starting with sequence number 1, and go through however many photos that we are exporting. Okay. Then I just put it into desktop, because most of the times when I do it is when I'm making the presentation. So I'll just export it on the desktop and put it into a Keynote or PowerPoint, whichever program you prefer to use. You can also resize the images so that it's not too big. This is the resolution that I use for most type of presentations. This should be sufficient. If you really want to be picky and you're presenting at a big stage, you can ask the resolution of the projector, and you can punch in those pixels here, and then you'll have the best possible resolution that you're gonna get. Okay, and then leave everything else the way it is, and then just click export. They are right here. Okay, now let's take a look at our final photos. Okay, any questions? I'm happy to answer. If you have questions about the equipment, I can also answer those. This is the time to ask any minor things. If you have a question, most likely the other participants will also likely have the same question as well. So.
All right. Here's a question. Do you take a shade photo with diffuser as well?
Oh, excuse me, I didn't get that. One more time, please.
Do you take a shade photo with diffuser as well?
So yeah, great question. I was during my last year in residency, I kind of felt more confident in taking photos, and I took all these photos with the diffuser and sent it to a very high quality lab, and they sent me a reply to my email saying that the light is too diffuse and there's so much like a big white light thing on the front of the teeth, so we cannot really look at the shade. Please watch this short video on how to take shade photos. I was kind of embarrassed at that time. Yeah, but when you take shade photos, it might be better to take it without the diffuser, because if you take it with a diffuser, it's gonna create that large surface area on the teeth that's kind of white colored. So it's for the lab technician, it's a little bit difficult to use that photo and do a good shade matching. What I recommend is if you have a twin flash, just take it off and shoot it at the 45-degree angle pointing towards the teeth, and you gotta adjust your exposure now to either adjust the aperture, because it's going to be much brighter light if you're pointing directly to the teeth. So they go down higher on the aperture or reduce your ISO. And it's always good to take it with a grade card, so you get the color balanced correctly. There is also something called the polarizers. They're polarizer filters that you can buy. They sell it at the BH, not the BH one, the Photomed. But you can also just buy the polarizing tape and the filter that goes on the lens. And if you use that, you're going to get a photo with zero reflection. But one thing to note about those is that if the lab doesn't know how to use that photo, it just means meaningless. So you got to use a lab that can, high quality lab that does good shade matching and knows how to use that photo, and then you can use that polarizing filters, two on your flash, and then one goes onto your lens, and then you can get those photos.
All right. Next question. Any tip on taking photos when patient is in sedation or in operating room under sterile environment?
So that's a difficult question. I never had to take a photo inside the operating room or when the patient is sedated. But if you are an oral surgeon or you mostly work on the surgical suite, then I would recommend putting a wrap in front of your flashes, like a sterile wrap, like you're wrapping your implant motor wrap. There is this plastic sterile wrap that you can buy. And then I'll put it around my camera as well, just leaving the lenses, and you can cover everything else. Or if you have a monolight, if your surgical suite is big enough to accompany the monolight, and if you're doing like a Laporte, like a big surgeries, then monolight might be beneficial in getting that diffuse light on the entire face. And then I'll try to wrap those with our sterile drape.
All right. And any tip on getting rid of fogs when there is no air or water syringe?
Yeah, so I mentioned that briefly in the presentation. I would either use the mirror warmer that you can buy, but that's extra money that you have to pay. You can just use the hot water and let it run on your mirror a little bit. That's gonna warm the mirror up, and it's not gonna fog anymore if you use that.
Right. I also use a tub of hot water just right next to the sink and have my assistant just keep the mirror in there as well. Nikon 750 or 850, which one is better?
Well, Nikon A50 is my dream camera, so I don't have that. It's very expensive. I think it costs like close to 3 grand now. But if I had the money, if money is not an issue, I would definitely go for Nikon the A50. I'm gonna get there at some point, but I don't have it yet. 750 is half of the price, and it's still full frame sensor. That's the camera setup that I have right now. But I heard that with the A50, the sensor is much better in capturing the little difference, subtle difference in the lighting. So you're going to get a much high quality image, and you can crop a lot because it has a lot of pixel count. So even if you crop a lot, your image is going to still look stunning. So if the money is not an issue, go for A50. If it is, 750 is still a great option.
All right. And how do you angle your camera to the mirror for occlusal shots? 90 degrees or 45 degrees?
I never thought of the angulation in numbers, but I don't know if you saw it on the video. I try to hold if I don't have assistant, I try to hold my mirror with the one hand like this and try to point to it. I think it's 45 degree angle. I don't think you can do it 90 degree. If you do it 90 degree, you're like looking through the teeth. So I would say 45 degree, but whatever works. In the viewfinder, you should kind of see your final photo on the viewfinder. But even if it's angled a little bit, I'm still okay. I think that's. I never thought about the degrees, but 45 generally sounds right.
Right. I think that's all the questions that we have for tonight. We'll give everyone another minute to think of any other questions if they have anything. Any other last minute tips you want to give, Dr. Jang?
So basically, I mean, I talked to you about how to take the stunning photos with the high quality like studio lights and all that stuff, but what really matters is you take the photos. If you go on the big meetings, all the presenters have amazing photos that inspires them, but if you don't have any photos, it's hard to tell what you did, and it's hard to like tell your colleagues, or you can also take a look at your own photos and see what you can improve on. I always, when I always do big procedures and take photos and come home and take a look at those, I always see a couple things that I could have done better. I mean, this fixation could have been a little better. The release could have been a little better. The closure can be a little better. So it's always a self-reflecting thing. If you take photos, you can improve by just looking at your photos. And sometimes it's what you're missing is not something very difficult to learn. You can, by just looking at the photo, you know what's wrong, and you can go try to fix that next time you do the same procedure. So that's why I think taking photos is important. It doesn't have to be this high quality. Just take it and have your own library of photos and have it organized so that you can use that later. So there are many uses. So just take more photos.
All right. We did get a couple more questions. How do you exaggerate curve of speed?
So if you want to document like exactly how the patient presents and the patient doesn't have the curve of speed going up, then you shouldn't exaggerate it. But to share and to make the image look better, it's better for the posterior teeth to go up a little bit. So what I do is I point the camera down more. So if you point the camera down and then you look at your viewfinder, and you can see that your back teeth are a little bit going up. So that's how I do it. You point your camera a little bit more down.
And any tips for lower shots?
Lower shots are challenging because of the tongue. Most of the times, if you have a patient with a small mouth and a big tongue, and it's very difficult to try to lift that tongue up and try to sneak in the occlusal mirror underneath that tongue and press that backwards. That's very difficult to do. My model was amazing. She didn't have a big tongue, a small tongue, very easy to reflect. But if you do find yourself in that situation, I would just try to take it with by not reflecting the tongue. I would take it with the tongue. Sometimes there's no good way of doing it. So I just put the mirror in, have them try to relax their tongue and take it with the tongue. So that's one modification that I would do if you have a difficult patient.
And let's make this last question. How often do you change the diffuser? Like per patient or how often?
Great question. So ideally, it's better to change your diffuser per patient because the diffusers, if you use them, tend to get really close to the mouth, and there can be saliva going into the diffuser and stuff like that. But if you don't have your own office, it's not easy to have a stockpile of the diffusers at hand. So generally speaking, whenever I do any surgical procedure and do a documentation, I change them.
Yeah, same.
Otherwise, I just wipe it down with the cappy wipe. But you should definitely wipe it down with a cappy wipe.
Right, and for me these days, since I'm using a fogger with hypochlorous acid, I just fog the whole camera with it as well. And
yeah, it's a good idea. You can also spray them with the hypochlorous acid. Hypochlorous acid, I think that's what it is. Yeah.
yes.
Yeah.
So, all right. So I think
But
that's
don't
all.
spray your cameras with the hypochlorous acid. It can damage the electronics. So just the diffusers.
Yeah.
Yeah.
All right. I think that's all we have. Let me hand it over to Rebecca again.
Amazing. Thank you so much, Dr. Jang and Dr. Koo, for your valuable share of knowledge. We thank everyone for joining us for today's session this evening. Furthermore, we have some quick announcements. On November 8th, we will be hosting a free webinar on understanding the new next and how to maximize opportunities to grow your practice with customer experience and marketing expert David Avrin. You can register at webinar.gdia.com. Please save the date. Furthermore, you will be provided a private recording to this webinar for you to conveniently access. Please wait about a week for this recording. You'll be informed when ready by the email you registered with. Lastly, please do not forget to fill out the evaluation survey at the end of this webinar. A survey must be submitted to receive your CE certificate. Furthermore, please expect the certificate by email within 14 business days. With that, we ask for your continued interest and support for our upcoming events. Thank you, and we hope you all have a great week.
All right. Have a good night.
Good night.